So the best part about what we offer here to take the edge off and to curb the anxiety that is associated with most dental treatment is we have the oral sedation route, which is simply taking a pill the night before and the morning of the appointment. And then we also follow that with IV sedation. So that when you come in, you're sedated through the appointment, which helps you kind of forget that you were here to begin with. And also helps with pain control throughout the procedure, helps keep you nice and calm, helps keep you nice and relaxed. It's putting you into a state that you don't really even know that you're here. So it's a phenomenal way for those, which is like most of us, that do have a great bit of anxiety coming into the dental office. I have found over the years that the best way for me to help relieve the anxiety associated with dental treatment is to be able to sit down and really go over the procedure. So much of what we fear as a dental patient is the fear of the unknown. What's gonna happen when I'm in the chair? What am I gonna hear? What am I gonna smell? What am I gonna see? What are these things that are gonna be happening? And for too long, patients have gone in, they've had a procedure done, they didn't totally understand why they were having it done, they didn't understand what was gonna happen. They just did it because a dentist told them that, hey, you need to have this done. They probably did need to have it done, but the problem is, they didn't fully understand it, and that added to their anxiety. So what we try to do is really sit down and calmly go over the plan, make sure that the patient totally understands what we're doing, make sure that they understand what the plan is, what the goals are. And I find that has a very calming effect because they understand that I care about their anxiety. When so many times I see patients that say, I told the dentist that I was nervous, and he just said, well, everybody is. And I told the dentist that hurt. He said, there's no way you feel that. I'm gonna believe what you tell me. If you tell me you're anxious, we're gonna fix it. If you tell me you're feeling pain, we're gonna get you comfortable. Those are the things that we take pride in doing. Contrary to what I do for a living, I don't like hurting people. I like helping people, and I like making people smile and having them be happy, healthy, and confident in their smile. One of the things I heard a long time ago was when people said dentistry is expensive. You're right, dentistry is expensive. But neglect is even more expensive. And it's very easy to kick things down the road when you're not hurting and when you're not in pain. I've had patients over the years that haven't been to a dentist or fit for 15, 20, even 30 years. And when I ask them, well, what brings you in here today? They said, well, I just think it's time for me to get looked at. It's been 20 or 30 years. Is anything bothering you? Nope. Any pain? Nope. They don't really realize what has happened in their mouth over time. And sometimes in those situations, things have gone so long that we are super limited in our ability to help fix the situation. Making sure that you stay on top of these things and making sure that you don't allow problems to snowball to where they get unmanageable or to get to the point where you don't have any bone. People don't sit around and say, oh, I'm losing bone in my jaw. You don't really realize that's happening, but it does. And so the longer you put things off, the worse it gets. The problems that you have today, if they're not addressed, are only going to be bigger problems down the road, and those bigger problems are going to cost more money, and they could potentially take much more time, and you could possibly wait and miss your window where a good, predictable option is even possible. If you are experiencing anxiety and have a major fear of dentistry, please call our office and schedule a consultation. We will help you get to a healthy smile, get you back on track with the help of conscious sedation.